Good morning. This is Jenna Reyes, Assistant Professor in San Diego campus and the ELM program of the Nurse School of Nursing. This is a nursing map being explained for use of our alternative clinical planning and virtual simulation. This nursing map was developed based on Bloom's taxonomy, Benner's theories of learning, and other active learning theories. This is a tool designed to help the students understand what is important and how to connect the dots following clinical experiences, simulation experience, or even virtual sim and didactic experiences. This map has been used very effectively for the last couple of years with nursing students who are considered at risk or who are struggling with making the connections. So this is a blank concept map. It doesn't have anything completed, but what's the most important pieces of it is really not the layout, although there's some priority in the layout to help them make the connections, but really what it is the headers that are important, that we need to make sure that the students are filling out these pieces. These are the main headers that they need to understand. So whatever the disease process goes here in the middle, and if it has multiple names, you can put that there. There's a space here so you can put other information that you want to make sure you remember. So important pieces, pathophysiology, that is, you want them to get down to as much of the cellular level as they can in the physiology of what's going on with the disease process. And then that'll help them to remember and fill out the risks for developing this disease process. We want to remind them that the pathophysiology drives the signs and symptoms. So what's happening at the cellular level is explained by what you're seeing in the signs and symptoms. And then the diagnostics are also explained by why are we doing which diagnostic and how is that showing the signs and symptoms. And the medication is used to treat it and how that is affected with the pathophysiology. And the main part, the most important piece, is the nursing diagnosis. So the nursing diagnosis will go here, and I helpfully put related to here and as evidenced by here so that they can remember that the nursing diagnosis is not using the disease process, but the pathophysiology. And then the nursing interventions need to go here because they're related to the nursing diagnosis, and what every nurse should do with their patient is educate. So this is a blank one, and here is a completed one. I completed this one earlier this week with GNRS 556, which is our Med-Surg 2 class in the ELM program. These students completed this one after doing a case study in irritable bowel disease. So important piece that you note, there's a couple of different colors. First thing, and really in priority importance, is that you have the students fill it out, not the faculty. The faculty can guide the students and kind of help them pick up pieces, but you want the students giving the answers and the information. It really can be used as an assessment tool to identify what they do know and what they don't know, and what the priority pieces are that they need to know. So you ask the students, okay, hey guys, what are we talking about here? Irritable bowel disease, sometimes they say called spastic colon. Okay, we're putting that there. Related to Crohn's, ulcerative colitis, we put that up there. And I started with the pathophysiology. What do we know is happening? What do you guys remember? And we want them to just throw out what they think they know, okay? And then we highlight the pieces, or we add in the pieces that they didn't know. After we fill it out completely with what they already know, with the plain, just white background with the black writing, then we go back and we review in the textbook. Well, what pieces did you not know? Or what pieces weren't forefront in your brain or that you didn't think of? And that's what goes in here with the bright green. The bright green is things that they couldn't remember, and that we want them to get as much of the cellular level as they can. And you notice here when we talked about the signs and symptoms, the students had put weight loss. Well, I didn't erase that, but we crossed it out so that they remembered it's not so much weight loss as much as the weight fluctuation, because that's what the textbook said. So the things they couldn't remember or didn't know that were in the textbook got highlighted with green. You notice we have this bright yellow. The bright yellow might have been something that they knew, but that the faculty came in and talked more about. And we all know that nursing faculty are telling you these important pieces because they're wanting you to know that this is a hallmark important piece to know about the disease process, because that's what you'll see a lot clinically, or that's because that's what they know they're going to test on. So bright green was what the students didn't know. Yellow is the stuff that the faculty made a big deal about. And then this bright pink or magenta is symptom management. That was highlighted because the students kept throwing out all these answers of types of medications, but they didn't understand why they were taking those medications. So this one got highlighted a third color of not only did they not recognize that that was the piece of it, but that's the thing that their faculty told them they really needed to remember. So the faculty was listening in on the call when we made this concept map together online following their virtual sim. Then we went over here to the nursing diagnosis. Fluid volume deficit related to, always in the pathophysiology, not the disease process, related to inflammation, as evidenced by diarrhea. That was the sign and symptom the patient had, right? And then we had them talk about what we would do for SMART goals for the nursing interventions. So we talked about by the end of the shift, they'll increase fluid intake by drinking at least 6 glasses of water daily. So that gave them a timeline and what they were going to do. And we want these to relate to these up here. They wanted to throw out risk for electrolytes as the very first one. And I explained to the students the risk always goes at the bottom because that's not your first priority. When you're doing these, try to prioritize your first nursing diagnosis. What is the first thing that is going to hurt the patient right now? And sometimes telling them the ABCs helps them with that as well. So quick video just to remind you what's plain black lettering is the stuff they already knew. Highlighted in green is the stuff they didn't know but they need to pay attention to. Highlighted in yellow was the stuff that the faculty told them they needed to pay attention to, and this bright magenta was when they had a real misconception that they needed to pay attention to. I hope this has been helpful. Quick video explaining how to use the concept map, which I'm calling nursing maps. And if you have any questions or feedback, please reach out. Reyes at apu.edu. Again, Reyes at apu.edu. Thank you.